If you're having a hip replacement, you may hear the terms cemented or uncemented or cementless implants. And let's talk about the differences between the two. So there are basically two ways that your surgeon can secure the stem of the implant into your femur or your thigh bone. And one isn't necessarily better than the other. It really comes down to the health of your bone. Hi, I'm Lorna Kleidman. I'm an 8-time world champion athlete, trainer, and the creator of 𝗛𝗶𝗽-𝗀𝗃. I've had both my hips replaced and still compete at the highest level. I want to help you to answer all your questions and guide you with the many, many issues that doctors and physical therapists don't often address. With a cemented stem, the surgeon uses a special bone cement called PMMA. It's a medical grout. This grout fills the space between the implant and your bone, and it hardens within minutes. So the stem has immediate fixation and you don't have to wait for the bone to grow around the stem. Then with an uncemented stem, which is sometimes called a press fit stem, there's no cement. And this implant has a rough porous surface that the surgeon fits into the femur, and that gives it the initial stability. Then over the next several weeks and months, as you're healing, your own bone grows into and over that porous surface. And that process is called osteointegration. How does your surgeon determine which one to use? Well, the biggest consideration is the strength and the quality of your bone. If somebody has good, strong bones, an uncemented approach works well because the bone can tolerate that press fit and grow into and around the implant. But for some older adults or women with osteoporosis, they may have lower bone density. Their bone is becoming thinner and more fragile, so it makes it difficult for that tight fit press to work for them with the uncemented stem. The objective of the surgeon is to get the implant to be very secure in the bone. So if the bone is fragile, you can imagine that there's a greater risk of the femur cracking during surgery or even afterward. Now, that doesn't mean that everybody over 65 needs to get the cemented implant, and it doesn't mean that cemented is better. In fact, there are many people in their 60s, 70s, and beyond who have excellent bone quality, and they do very well with the cementless fixation. So when you go into your consultation with your surgeon, ask them, do you plan to give me a cemented or cementless stem, and why? And sometimes surgeons use a hybrid approach where one component is cemented and the other isn't. So it doesn't have to be either or. And remember, the best implant fixation isn't the one that your neighbor had or Aunt Sally had. It's the one that's right for you, for your body, your bone quality, your lifestyle. Find out more about my 𝗛𝗶𝗽-𝗀𝗃 course designed for active adults who are either considering, preparing for, or recovering from hip replacement after their physical therapy has ended. See the link in the description below. And if this video is helpful, please like, share, and subscribe. I'll see you at the next one.